Good morning, Judge Stout, Commissioners, and Director Wood. My name is Caroline Crain, and I'm a medical student from Houston. I also serve as the Public Health Fellow for the Texas Jail Project through the Albert Schweitzer Fellowship, and I'm a graduate of the UT Health School of Public Health in Houston. I spent the past year collaborating with community members and advocates involved in Texas's criminal justice system. Before starting this fellowship, I naively assumed that healthcare in jail was equivalent to that in the community, just with perhaps increased security. Instead, what I found was a system that is blatantly neglectful and harms our state's most vulnerable. As a future physician, I can't even reconcile what I've seen with my oath to do no harm. The system is simply unrecognizable. Although there are many reforms needed, I'd like to propose 3 today. So long as people with mental illness are in Texas jails, we must provide them with, at a minimum, continuity of care. I'm grateful that the Sandra Bland Act mandated CCQ checks to identify people with serious mental illness or SMI. However, there is no legal mandate to act on positive CCQ hits. As such, when people with SMI enter jail, they may lose access to the medications that keep them stable and the LMHA under which they receive care. I recommend a legal mandate that requires jails connect anyone with a positive CCQ check to the contracted LMHA or mental health care provider. My next recommendation, which I believe is similarly attainable, is providing detained people with the standard of care for psychiatric conditions. Due to limited drug formularies, previously stabilized regimens may be changed to wholly inappropriate ones or even discontinued altogether. I'd like to take a moment to specifically call Dr. Porce's attention as the Commission's medical expert to this clinical concern. I have been deeply alarmed upon learning that individuals with schizophrenia, psychosis, or bipolar disorder in jail are not being treated with antipsychotics, but rather antidepressants like fluoxetine, drugs that do nothing for these conditions and may in fact worsen them. It is absolutely essential that jail standards include the provision of standard of care treatment for schizophrenia, bipolar disorder, and psychosis. With that, I'd like to emphasize the urgent need for improved recognition and treatment of medical conditions in jail. Every year, Texans die in jail for reasons that would surely constitute malpractice if it occurred in the community. This is wholly unacceptable. Being detained should not take away an individual's right for quality care. Again, Dr. Porce, I trust you share my concern when I share that Texans have died in jail from diabetic ketoacidosis after being denied insulin, from septic shock following untreated infections, and even Waterhouse-Friderichsen syndrome after weeks of untreated severe illness. In any other healthcare setting, a clinician who displayed such horrific negligence would face malpractice lawsuits if not sanctioned on their license. If this is such a serious infraction for free individuals, why do we allow it to happen to people behind bars? It is not enough to show the procedures are in place if these procedures are not being appropriately activated. It is unacceptable that jails can currently maintain compliance while allowing people to die completely preventable deaths within their walls. I believe that the changes that I outlined today are the highest impact and most readily attainable. However, please review the packet I provided for additional information on the cases I've seen this year and recommendations for improved jail standards. The lives of thousands of Texans, many of them our most vulnerable, depend on the work of this commission. Thank you.
Thank you.